Hi everyone, my name's Erin and I'm going to be the physical therapist today. This is Kelsey, she's going to be our patient, and then our lovely camerawoman is Brittany. Today we're going to be talking about how to measure cervical lateral flexion or side bending. And so the biomechanical rationale behind this is we're looking at the lateral range of motion of the upper and lower cervical spine combined. Specifically, we're looking at any limitations to motion that might be caused by either abnormal tightness in the musculature in the neck and the cervical spine specifically, or any ligamentous or other structure impairments. Specifically, when you're looking at cervical side bending, we're looking at the motion in the frontal plane here. So, for example, on Kelsey, we would be looking at just this pure motion here, and then just like so. Now, when you're assessing the cervical side bending, you want to be moving in a range to where you feel a very firm end feel. The firm end feel is elicited by tension in the ligaments on the side of the spine here. So specifically the intertransverse ligaments, and then also the soft tissue structures that would be impeding the motion on the contralateral side of the flexion that you're imparting, such as the upper traps, the scalenes, and other musculature that's there. For this, there are certain contraindications and indications for when you would want to assess the lateral side bending for the cervical spine. For example, you wouldn't want to conduct this test if your patient has any cervical spine pathologies, specifically in like the discs, such as a herniated disc, because this could elicit a lot of pain in the patient. You also wouldn't want to look at cervical side bending if the patient has any cervical spinal precautions from their physician, or that would limit the amount of side bending or flexion or extension or overall movement that you would see in the spine. So we discussed some of the contraindications about when we wouldn't want to assess cervical side bending. However, the indications for when we would want to assess this is if our patient reports any difficulties bending their head due to maybe some tightness in their musculature, or any other limitations while doing functional tasks, such as bending to look at things or bending to look under objects. Then we would want to assess their cervical side bending to see if there is any limitations due to maybe some of the soft tissue structures or other complications. As far as this test, we'll be using a universal goniometer. So this is a large universal goniometer right here. For this specific test, looking at cervical side bending, the reliability of this measurement is fairly high to moderate, with inter-rater reliability ranging from 0.7 to 0.8 approximately, and inter-rater reliability ranging from 0.6 to 0.75 approximately. So overall, the reliability of these measures are moderate to high in reliability, with the validity not being reported on. So when you're performing this actual measure, you want your patient to be seated with their thoracic and lumbar spine mostly supported, just like Kelsey is here. Then we're going to look for our bony landmarks in order to align our goniometer correctly. Now we're going to step over to the skeleton really quickly. Our axis or fulcrum for the measurement is going to be the spinous process of C7. So on the skeleton, you can count down 1, 2, 3, 4, 5, 6, and 7. So this is where our fulcrum will be aligned. Then our movable arm will be aligned with the occipital protuberance on Kelsey, so that's right here. And then our stationary arm will be in line with the spinous processes of the thoracic spine. To find C7, you would palpate for one of the most prominent spinous processes in the neck. Then to check and make sure you're on C7 as opposed to C6 or T1, you would have Kelsey look up at the ceiling. Perfect, and then back down. And what you're feeling for is C7 shouldn't move, it shouldn't dive deep when she does that, whereas C6 will. And then T1 also won't move, so you want to make sure you check the vertebrae above if it's not diving deep, just to make sure you're on C7 and not T1. So I'm going to have you look back at the ceiling again for me. Good, move forward. And again. Good, and back forward. So Kelsey's C7 is right here. So that's where our fulcrum would be. Then we would line up the stationary arm with the rest of her spine, the spinous processes, and the movable arm with her occipital protuberance, which is right here. It's very important to make sure that all of your landmarks are exposed while you're doing these measurements so that you can visually see and make sure that your alignment of the goniometer is correct while you're making these measurements. Additionally, it's really important to make sure that the motion that you are measuring and observing is purely in the frontal plane, so in this plane right here. So you don't want any flexion or extension of the head or any rotation going on as well, so that we know that it's a pure sine bending motion that we're observing. In order to help make sure that this is the case, initially before we even pick up the goniometer, we're going to talk to Kelsey about how she's going to move her head and instruct her. We'll do this by stabilizing the same side shoulder to make sure that there isn't any rise or flexion in the shoulder girdle or in the thoracic spine. Then we're going to gently lay our hand on the contralateral side of her head and then guide her head in the motion that we want to observe. And then we can also ask if there's any pain with that motion, just so we can stop and make sure that we don't aggravate any conditions any worse. While we're doing the side bending motion, you want to make sure that she stays in that frontal plane and that there's no rise in the shoulder that we're stabilizing, because that would signify side bending in the thoracic spine as well. Excellent. Although today we're going to be just talking about using a goniometer to measure the cervical side bending, you can also use an inclinometer or a tape measure to assess this measurement as well. People are going to vary in the degrees that they're able to achieve, especially depending on whether or not a pathology is present. However, the normative values for a healthy adult population is around 22 degrees for both left and right side bending. So now we're going to go ahead and run through as if Kelsey is our patient and she has come in and we need to assess her cervical side bending range of motion. Hi Kelsey, how are you doing today?
I'm good.
Good. My name's Erin O'Mani. I'm going to be your physical therapist today. Now, I know you've been experiencing a little bit of tightness in your neck. Is this correct?
Yeah.
Great. So what we're going to do today is we're actually going to measure your range of motion for side bending in your neck. So how close you can get your ear to your shoulder and in both directions. Does that sound okay?
Yeah.
Wonderful. Okay. So the first thing we're going to do is you already have your shirt off so I can see bony landmarks, which is perfect. So the first thing I'm going to do is I'm going to go ahead and guide your head in the motion that I want you to do while I do the measurement. Is that okay?
Mm-hmm.
Great. I'm going to place my hand right here, and then when I tell you to, I want you to just lean your head straight over like so until you feel a good stretch. Okay?
Okay.
So I want you to make sure that the shoulder stays down. So I don't want you to bring the shoulder up like this, or to flex forward and down, or to rotate at all. I just want a nice straight side bend motion. Sound okay?
Yes.
Great. So now, what I'm going to do is I'm going to find my landmarks. So I'm going to palpate for a bony landmark back here. Can you go ahead and look up at the ceiling for me? And back down. Perfect. And then back up for me. And down. Great. So that's where her C7 spinous process will be. So I'm going to use this. It's called a goniometer. And that's what's going to measure your motion. I'm going to line it up back here. So the fulcrum's over C7. The stationary arm is over the spinous processes of the rest of her spine. And the movable arm is in line with her cervical protuberance. Okay, Kelsey, I'm going to have you do the side bending motion. Perfect. So we're going to reconfirm that the axis is still over C7. The stationary arm is still over her spine. And then the movable arm is in line with her cervical protuberance. Okay, you can go ahead and look straight ahead. So for Kelsey, she got about 26 degrees of side bending, so she's a little bit extra. And then you always want to make sure to assess both sides for range of motion. So Kelsey, we went ahead and looked at her right side bending. Now we're going to look at the left. So we found C7 again. We're going to line up the goni fulcrum with C7, and then our stationary arm is in line with the spine. Okay, our movable arm is in line with the occipital protuberance. So Kelsey, I want you to go ahead and bend your head to this side, bringing your ear to your shoulder. Okay, so we make sure that the fulcrum is still in line with C7, stationary arm is still in line with the spine, and then the movable arm is in line with the occipital protuberance. And then to this side, Kelsey got about 28 degrees. You can go ahead and look straight ahead. So a little bit more to the left than she did to the right. And that's how you assess cervical side bending.